Hey everybody, my name is Denise Virunji Evans. My community is the city of Tampa, located around the Gulf of Mexico, in the Hillsborough County in state of Florida, known as the Sunshine State. A little bit of history of Tampa. The first population to occupy Tampa were the Spanish in 1528. The next wave was the indigenous people or the Native Americans in after 3,000 years. And then after that was the European explorers that brought some diseases that affected the Native Americans. And in 1821, Tampa, Florida was sold to the United States. Tampa has population of 3,000 people, a little bit more. And of the 3,000 people, 45% are white, 23% are African American, 24% are Hispanic, and 9% are others, mixed race, Asians. Poverty levels are very high in African American communities. Education, at least 87% of Tampa residents have at least a high school diploma, with more women than men, and 42% white have at least a 4-year degree, and 63% of Asians have more than a 4-year degree. When it comes to income, $50,000 is the median income in Tampa, and like any other state, male are paid more than female. Male with a college degree are paid $60,000, than female who have a college degree are paid 42%, which is not right. Employment, we have more jobs in Tampa in healthcare, retail, management, and up to 11%, and then less in other departments. I did my window shell drive around the community. On the screen are 2 pictures that I selected because I wasn't sure if I can put all my pictures because I took a lot of pictures, but I wanted to get 2 significant pictures that I can at least analyze of some of the significances that I found in my community. The picture on top is a gas station. If you look closely, it's a lot of advertisement of fast food and, tobacco products, alcohol. And this picture was taken from the low income, the east side of town. The picture below is a historical building that used to be a cigar factory. So this is just for tourism purposes. And that is located in the west side of town. The west side of town is usually the Hispanic. The east side of town is the African Americans. The south side of town is the white population, very rich. And then the northern part of Tampa is everybody. I did my 2 interview with 2 distinct individuals who are both in healthcare. One is a community manager and the other one is a nurse. Mr. Gary, who is a community manager, explained that working with other organizations is a big accomplishment in order to get community assessment, because every community agency has different knowledge, different connection. And it was the same thing with Miss Sanyu, who's a nurse at the Veterans Hospital. The most significant about these 2 individuals' interviews is that they are both facing the same problems in Tampa. Ms. Sanyu explained that at the Veterans Hospital, they are seeing a lot of veterans that are faced with substance abuse, but most of them are very obese. Same thing with Mr. Guri. He explained that individuals that need substance abuse services, they are also faced with obesity. So I thought that was a really significant connection between what you can find into these communities, and they both work in different communities or different parts of Tampa. When it comes to community health, the highest health problem that is really facing the people in the community of Tampa is obesity, and mostly African American communities. So it's not only the adults but also youth. So what we are seeing here is 14%, according to the CDC, 4% of adults in Tampa are obese. This has led to so many other diseases like heart disease, which is, it's increasing due to a lack of physical exercise, lack of health foods around some of the communities, with the fact that the gas station are left as the grocery stores for people who have less access to certain foods. And, one of the big problems that is facing in Tampa is we have poor public transportation. So even if somebody wanted to leave their community to go a nearby community, public transportation is very, very poor compared to other big cities like Miami or St. Pete, which is right across the bridge. Smoking is another one. It's really interesting because when you look at the CDC statistics that just came out, is the traditional tobacco has gone down, but the e-cigarettes and the Juul amongst high school and adult has gone up to 20% from 2007 to 2017. So these Juul companies or e-cigarette companies are advertising to the youth and also adults as a quitting aid, which is not true because they're not really approved by the FDA. So that's a big problem we're seeing here in Tampa and in most of our schools. Life expectancy in Tampa is 76 years for both women and female and male. But the white female have higher life expectancy up to 82 years than other race or other gender. Healthcare insurance plans are high compared to other counties or other cities around us, especially the fact that we got a lot of enrollment in Affordable Care Act, which has been helping so much. At least 50% of residences in Tampa have a family plan or a healthcare plan, and they have received a primary care physician in the last year. When it comes to assets, resources, and capability in Tampa, we are really well equipped. For example, we have at least 10 hospitals, public, private, and government owned. We have over 56 middle schools, 27 high schools, 10 universities with public, private, and other like for-profit. We have a ton of businesses. We have like United Way, name it. We have it here. Being a big city with 5 million people, we get a lot of those. We have individuals from healthcare professionals to researchers, especially the big university on to the bottom, University of South Florida, employs a lot of medical and researchers. When it comes to neighborhoods, we have the Hillsborough River that provides everybody natural resources. We have parks and recs that provide a lot of outdoor activities to families, which is very, very good. Strength and limitation. Time, resource, and data can be both strength and limitation. When it comes to community assessment, approaching community partners and stakeholders, time can be of cautious depending on how much time you need from them to produce the data. Same thing to the individuals if you're trying to collect data. Resources, if you don't know what resources needed or the resources we have in the community, can be strength and can also be limitations. Recommendations, because obesity is our biggest problem, health, food, and diet is a big thing, and increasing access to all residences. Thank you.